Assalamu alaikum. I am Dr. Nahid. I am going to discuss with you about a very important topic which comes almost every year in MRCS part exam. That is, what type of changes occurs during different type of shock. In another word, that is the pathophysiology of different type of shock, and what kind of treatment we should start in case of different type of shock. I will try to explain this in a very short video. I hope it will be very helpful for you in your upcoming exam. So let's move on to our topic. First of all, to understand the pathophysiology of shock, I think we need to talk about two ideas. Uh, One is cardiac output. We all know cardiac output means heart rate into stroke volume. I'm writing it in short form. HR means heart rate and SV means stroke volume. So cardiac output means the amount of blood the heart can pump in a single minute, and we all know stroke volume means the amount of blood that the heart can pump in a single systole. So cardiac output will be a heart rate into stroke volume. Another very important information that we need to know is that stroke volume decreases if our blood vessels vascular resistance increases. That means if our systemic vascular resistance increases, in that case our stroke volume will decrease automatically. So there will be a negative relationship between stroke volume and systemic vascular resistance. Let me write this down. So stroke volume has a negative relation with systemic vascular resistance. So what will happen if there is any increase in systemic vascular resistance? Our stroke volume will decrease, and if stroke volume decreases, that means our cardiac output will also decrease. At the same time, if systemic vascular resistance increases, we will see there will be an increase in stroke volume, and also there will be an increase in cardiac output. These two informations are very important. Now we will move on to our next part of discussion. Okay, so in case of pathophysiology of shock, first of all, we need to know about the different parameters. So what are the parameters that we will discuss? One is heart rate, another one is cardiac output, another one is systemic vascular resistance. So first of all, let us move on to cardiogenic shock. What happens in case of cardiogenic shock? In case of cardiogenic shock, there is injury to the heart muscle, which may be as a sequelae of myocardial infarction. There is death of myocardial muscle and the heart cannot pump blood, or there might be any kind of trauma, such as there might be chest trauma which have penetrated the myocardium, or there might be myocardial contusion. So the heart will not be able to pump blood. So what will happen? The heart cannot pump blood. So the stroke volume will decrease, and we all know stroke volume, if stroke volume decreases, there will be decrease in cardiac output also. So in case of cardiogenic shock, the first thing will happen will be there will be decrease in cardiac output, and we all know whenever there is decrease in cardiac output, there will be decrease in blood pressure, and if blood pressure decreases, we know baroreceptor feedback mechanism will become activated. We all know this, right? And what will happen? Baroreceptor will try to increase our heart rate and force of contraction by activating the sympathetic nervous system. So what will happen? Whenever following cardiogenic shock, our stroke volume decreases, so will decrease our cardiac output, and whenever our cardiac output decreases, what will happen? The baroreceptor will try to increase the blood pressure, so they will activate the baroreceptor, and they will activate the baroreceptor and will activate the sympathetic nervous system. So our heart rate will increase, and our systemic vascular resistance will also increase, because there will be wide or split vasoconstriction. So this is the pathophysiology of cardiogenic shock. Again, I am going to explain it very clearly. What happened here? There is disability of cardiac muscle, which may be as a sequelae of myocardial infarction, or following trauma there will be myocardial contusion. So there will be decrease in stroke volume, there will be decrease in cardiac output, and baroreceptor will try to increase the blood pressure by activating the sympathetic nervous system. So what will happen? We will see that there will be increase in heart rate, and at the same time there will be vasoconstriction leading to an increase in systemic vascular resistance. So in case of cardiogenic shock, the heart rate will be increased, cardiac output will be decreased, and systemic vascular resistance will also increase. Now let us move on to hypovolemic shock. What will happen in case of hypovolemic shock? In case of hypovolemic shock, the first change in the body is there is decrease in intravascular blood volume, which may be due to hemorrhage, which may be due to diarrhea, which may be due to dehydration. This may be due to any cause, but the first important thing here is there is decrease in blood volume. So whenever there is decrease in blood volume, the heart cannot pump much blood out, so there will be decrease in cardiac output. So here what will happen also? The cardiac output will decrease, and here the same thing will happen again as it has happened with cardiogenic shock. That is, whenever cardiac output decreases, blood pressure also decreases, and if blood pressure decreases, baroreceptor will be activated. Baroreceptor will try to activate the sympathetic nervous system, so there will be increase in heart rate, and also there will be increase in systemic vascular resistance. So we can see that in case of cardiogenic shock and hypovolemic shock, in both of these type of shock, there will be decrease in cardiac output, there will be increase in the heart rate, and there will also be an increase in systemic vascular resistance. So how we can differentiate these two type of shock? We can differentiate these two type of shock by checking the pulmonary capillary wedge pressure. What is that? I am writing it down. Pulmonary capillary wedge pressure. So think about this very simply. What happens in case of cardiogenic shock? I have enough blood in my body. All the bloods are coming to heart, but heart cannot pump those blood out. So there will be pooling of blood. There will be a lot of blood will be in my pulmonary bed. So there will be increase in pulmonary capillary wedge pressure. But in case of hypovolemic shock, I don't have enough blood in my body. So there will be no pooling of blood in the pulmonary bed. So our pulmonary capillary wedge pressure will be decreased. So you can see here that cardiogenic and hypovolemic shock in terms of three parameters, that is cardiac output, heart rate, and systemic vascular resistance, are almost same. We can differentiate these two by checking out the pulmonary capillary wedge pressure. In case of cardiogenic shock, pulmonary capillary wedge pressure will be high, raised, and in case of hypovolemic shock, pulmonary capillary wedge pressure will be decreased. So let us move on to our next important shock, that is septic shock. We all know the pathophysiology of septic shock. The main pathophysiology of septic shock is, we know that there is a lot of inflammatory cytokines in our circulation which will cause vasodilatation. That means first thing will be systemic vascular resistance will decrease, right? So if systemic vascular resistance decreases, we all know, as I already mentioned at the beginning of the video, systemic vascular resistance has direct relationship with stroke volume. So whenever systemic vascular resistance decreases, stroke volume will rises. So what happens? Our cardiac output will also increase. But whatever the cardiac output increases or not, as we all know, this is shock. Shock means there is hypotension. So here also baroreceptor will be activated, and what will happen? We will see our heart rate is increased. So in case of septic shock, first thing that happens is there is a lot of inflammatory cytokines, and they will cause vasodilatation. And whenever there is vasodilatation, we know systemic vascular resistance will decrease. As there is decrease in systemic vascular resistance, our stroke volume will increase, and our cardiac output will also increase. As this is a shock condition, that means baroreceptor is activated, sympathetic nervous system is activated, so our heart rate will also increase. Now let us move on to our next topic, that is neurogenic shock. What happens in case of neurogenic shock? In case of neurogenic shock, there is increased parasympathetic nervous system activity, or there is decreased sympathetic nervous system activity. So what will happen here? We will see our heart rate will decrease because parasympathetic nervous system is activated. Our cardiac output will also decrease. Why? Because our heart rate has decreased very much. So cardiac output, we all know cardiac output means heart rate into stroke volume, but as there is very much decrease in heart rate here, cardiac output will also decrease very much, and also there will be decrease in systemic vascular resistance. So what is happening in case of neurogenic shock? Let me summarize this. There is increased activity of parasympathetic nervous system. We all know parasympathetic nervous system causes decrease in heart rate and cardiac output, and also force of contraction of the heart. So there will be decrease in heart rate and cardiac output, and also there will be vasodilatation leading to decrease in systemic vascular resistance. Here you can see, though there is decrease in systemic vascular resistance, the cardiac output has not increased because our heart rate is also very decreased. So in case, as you have already seen, in case of septic shock, whenever there is decrease in systemic vascular resistance, cardiac output increased. But here what happened? Though there is decrease in systemic vascular resistance, as also our heart rate is very low, so overall cardiac output is also very decreased. So now let us move on to our last important type of shock, that is anaphylactic shock. We all know anaphylactic shock is mediated by histamine. What? Histamine. And we all know histamine causes vasodilatation leading to decrease in systemic vascular resistance, and it also causes increase in heart rate. But what happens here is, in case of histamine, there is so much vasodilatation happens in case of anaphylactic shock that the preload, that is the amount of blood that comes to the heart just immediately prior to the systole, it is very low. And we all know there is a law which we all call Frank-Starling law, that is, if preload is very much decreased, then the force of contraction will also be decreased and there will be decrease in cardiac output. So in case of anaphylactic shock, due to histamine mediated vasodilatation, there is peripheral pooling of blood and very little blood will come to the heart. So the preload will be very much decreased, and what will happen is our cardiac output will also be decreased. But histamine can increase our heart rate. So what happens here is, there will be decrease in systemic vascular resistance because of histamine. There will be increase in heart rate because of histamine. But though there is decrease in systemic vascular resistance, our cardiac output is decreased. Why? Because here preload is very much decreased. That is why, though systemic vascular resistance has decreased, there should have been an increase in cardiac output. But this doesn't happen here because the preload is very much decreased here. So this is the important concept in case of what type of changes occur in different type of parameters in case of different type of shock. So let us move on to another important information, how we should treat those. In case of cardiogenic shock, let me clear this first. Okay, in case of cardiogenic shock, we all saw what happened here. Here there is mainly fail in muscle. The power of muscle is decreased. So we should use some drug. Those are beta 1 agonist, and an important drug is dobutamine. Dobutamine acts on beta 1 receptor and it will increase the force of contraction of the heart muscle. So cardiogenic shock is treated by dobutamine. Let us move on to hypovolemic shock. In case of hypovolemic shock, you cannot give any vasopressor or inotrope or chronotrope because it will exacerbate the condition. So hypovolemic shock, its main treatment is to restore the volume. First and most important treatment is restore the volume. This is very important. Okay, so after that, let us move on to septic shock. In case of septic shock, the first change is vasodilatation. So what we have to use? We have to use such kind of drug that causes vasoconstriction, and we all know alpha 1 of sympathetic nervous system, alpha 1 receptor sympathetic nervous system mediate vasoconstriction. So we have to use vasopressor. What kind of vasopressor? Those that acts on alpha 1 receptor, and we all know noradrenaline acts only on alpha 1 receptor, noradrenaline. So in case of septic shock, I have to give noradrenaline or vasopressor. In case of neurogenic shock, what you need to do? In case of neurogenic shock, what we need to do is, here first treatment is volume replacement. If the volume is replaced, it should increase the parameters of the neurogenic shock. But if only volume replacement does not improve the condition, in that case we also have to use vasopressor, just like septic shock. What are the vasopressors? Those are alpha 1, that is noradrenaline. Okay. And in case of anaphylactic shock, we all know this is mediated by histamine, and histamine is causing vasodilatation. Histamine is decreasing our blood pressure, and it is also acting on the whole body. So histamine's effect is also on lung, that is bronchoconstriction. So here we have to use an agent that has effect on every receptor of the sympathetic nervous system, that is alpha 1, alpha 2, beta 1, beta 2, beta 3. For this region we have to use adrenaline. So adrenaline is used in case of anaphylactic shock because it acts on every receptor, alpha 1, alpha 2, beta 1, beta 2, all. Because you can understand easily what happens in case of anaphylactic shock. There is also simultaneous vasoconstriction, vasodilatation, and also simultaneous bronchoconstriction, and we all know bronchoconstriction is mediated by beta 2 receptor. So what we have to do, if we use noradrenaline here in case of anaphylactic shock, then it will only act on the blood vessel, but it will not act on the lung. So we have to use an agent that has simultaneous effect on blood vessel and also on lung. That is why we have to use adrenaline. So these are all about different type of shock. I hope you have enjoyed the video. If you have any suggestion or any query, feel free to ask me in the inbox. Thank you very much.